Polymyalgia rheumatica, or PMR, and temporal arteritis, often referred to as TA, are two inflammatory conditions that often affect older adults. While they share some similarities, they are distinct conditions with their own set of symptoms and potential complications. Understanding these conditions is crucial for early diagnosis and effective management. These conditions can cause pain and discomfort. They can also lead to serious complications if left untreated. This essay will provide you with a comprehensive overview of PMR and TA, including their causes, symptoms, diagnosis, and treatment options. Early diagnosis and treatment are essential for both PMR and TA. If you experience any of the symptoms discussed in this essay, consult your doctor promptly. With proper management, individuals with PMR and TA can live full and active lives. Polymyalgia rheumatica, or PMR, is an inflammatory disorder that primarily affects the muscles and joints, leading to pain and stiffness. It typically affects people over the age of 50, with women being more susceptible than men. The symptoms can be quite debilitating, making everyday activities challenging. The exact cause of PMR remains unknown, but it is thought to be triggered by a combination of genetic and environmental factors. Researchers are still trying to pinpoint the specific triggers. PMR is characterized by inflammation of the lining of the joints, particularly in the shoulders, neck, and hips. This inflammation is what leads to the hallmark symptoms of the disorder. The pain and stiffness can be severe, often worse in the morning or after periods of inactivity. This can significantly impact a person's quality of life. This inflammation causes pain, stiffness, and limited range of motion. Many people with PMR find it difficult to perform simple tasks like getting dressed or reaching for objects. The onset of PMR is often sudden, with symptoms developing over a few days or weeks. This rapid development can be alarming and lead to a quick decline in physical function. While the exact cause of PMR is still being researched, it is believed to be an autoimmune disorder. This means that the body's immune system mistakenly attacks its own tissues. Healthy tissues, in this case, the lining of the joints. This autoimmune response is what leads to the inflammation and pain. Certain genetic predispositions and environmental triggers may play a role in the development of PMR. Understanding these factors is crucial for developing better treatments and potentially preventing the disorder in the future. The hallmark symptoms of PMR are pain and stiffness in the shoulders, neck, and hips. This stiffness is usually worse in the morning or after periods of inactivity. It can make it difficult to perform everyday tasks such as combing hair, getting dressed, or getting out of bed. Other common symptoms of PMR include fatigue, low-grade fever, loss of appetite, and weight loss. Some people may also experience flu-like symptoms such as muscle aches and weakness. The severity of symptoms can vary from person to person. It is important to note that the symptoms of PMR can mimic other conditions, making diagnosis challenging. If you experience persistent pain and stiffness in your shoulders, neck, or hips, it is crucial to consult your doctor for a proper evaluation. Temporal arteritis, or TA, also known as giant cell arteritis, is a serious condition that causes inflammation of the arteries, particularly the temporal arteries located on the sides of the head. If left untreated, TA can lead to severe complications such as vision loss, stroke, or even death. Like PMR, TA primarily affects older adults, typically those over the age of 50. The exact cause of TA is unknown, but it is considered an autoimmune disorder where the body's immune system attacks the walls of the arteries. TA is a medical emergency that requires immediate attention. If you experience any symptoms suggestive of TA, seek medical attention immediately. Early diagnosis and treatment are crucial for preventing serious complications. Section 5. Spotting the signs of temporal arteritis. The most common symptom of TA is a headache, usually located on one or both sides of the temples. The headache may be severe and persistent, or it may come and go. Other symptoms include tenderness or pain in the scalp, jaw pain while chewing, blurred or double vision, and sudden vision loss. In some cases, TA can also cause flu-like symptoms such as fever, fatigue, and weight loss. As the inflammation progresses, it can affect other arteries in the body, leading to complications such as stroke or aortic aneurysm. It is important to note that not everyone with TA experiences all of these symptoms. Some people may only have a few mild symptoms, while others may experience a sudden onset of severe symptoms. Section 6. Who is at risk for PMR and TA? Both PMR and TA are more common in older adults, with the risk increasing with age. These conditions are rarely seen in people under the age of 50. Women are more likely to develop PMR and TA than men. While the exact causes of PMR and TA are unknown, certain factors may increase your risk of developing these conditions. These include a family history of PMR or TA, certain viral infections, and exposure to environmental toxins. It is important to note that having these risk factors does not mean that you will definitely develop PMR or TA. However, it is essential to be aware of these conditions and seek medical attention if you experience any symptoms. Section 7. Diagnosing PMR and TA. Diagnosing PMR and TA can be challenging because their symptoms can mimic other conditions. Doctors rely on a combination of medical history, physical examination, and laboratory tests to make an accurate diagnosis. Blood tests are often the first step in diagnosing PMR and TA. Elevated levels of inflammatory markers such as C-reactive protein or CRP and erythrocyte sedimentation rate or ESR can indicate inflammation in the body. In addition to blood tests, imaging studies such as ultrasound, magnetic resonance imaging or MRI, or positron emission tomography or PET scans may be used to visualize the affected arteries and rule out other conditions. A biopsy of the temporal artery may be necessary to confirm the diagnosis of TA. Section 8. Treatment options for PMR and TA. The primary goal of treatment for PMR and TA is to reduce inflammation and prevent complications. This involves a comprehensive approach that includes medication, lifestyle changes, and regular monitoring by healthcare professionals. Corticosteroids, such as prednisone, are the mainstay of treatment for both conditions. These powerful anti-inflammatory drugs can provide rapid relief of symptoms, often within days. These medications work by suppressing the immune system and reducing inflammation. By doing so, they help to control the overactive immune response that characterizes both PMR and TA. The dosage and duration of corticosteroid treatment vary depending on the severity of the condition and the individual patient's response. Regular follow-ups are essential to adjust the treatment plan as needed. Long-term use of corticosteroids can lead to side effects such as weight gain, osteoporosis, and increased risk of infections. Therefore, it is crucial to balance the benefits and risks of these medications. In addition to corticosteroids, other medications such as methotrexate or azathioprine may be used to reduce the dose of corticosteroids or manage symptoms in people who cannot tolerate corticosteroids. These medications can be effective in maintaining remission and preventing relapses. Lifestyle modifications, such as regular exercise and a healthy diet, can also help manage symptoms and improve overall health. Engaging in physical activities and maintaining a balanced diet can enhance the effectiveness of medical treatments and contribute to a better quality of life. Section 9. Living with PMR and TA tips for daily management. Living with PMR and TA can be challenging, but there are steps you can take to manage your condition and improve your quality of life. It's important to understand that while these conditions can be demanding, with the right approach, you can still lead a fulfilling and active life. Here are some tips for daily management that can make a significant difference in your day-to-day living. Take your medications as prescribed. It is crucial to take your medications exactly as prescribed by your doctor. This ensures that you are getting the right dosage and the full benefit of the treatment. Do not stop taking your medication or adjust the dosage without consulting your doctor. Always communicate any side effects or concerns you may have. Pace yourself. PMR and TA can cause fatigue and pain, which can be overwhelming at times. Pace yourself throughout the day and avoid overexertion. Listen to your body and take breaks when needed. Take frequent breaks and prioritize rest. Rest is essential for recovery and managing symptoms. Stay active. While it is important to pace yourself, regular exercise can help improve your strength, flexibility, and range of motion. Physical activity can also boost your mood and overall well-being. Engage in low-impact exercises such as walking, swimming, or cycling. These activities are gentle on your joints and can be easily incorporated into your daily routine. Eat a healthy diet, A balanced diet rich in fruits, vegetables, and whole grains can help reduce inflammation and boost your immune system. Proper nutrition is a key component of managing your condition effectively. Manage stress. Stress can worsen symptoms of PMR and TA, making it important to find ways to manage it effectively. Find healthy ways to manage stress, such as yoga, meditation, or spending time in nature. These activities can help calm your mind and reduce stress levels. By following these tips and working closely with your healthcare provider, you can effectively manage your condition and live a fulfilling life. Remember to stay proactive and engaged in your health management. Remember, you are not alone in this journey. There are many resources and people who can support you. Support groups and online communities can provide valuable information, resources, and emotional support. Connecting with others who understand your experience can be incredibly beneficial.